Good morning, my name is Caitlin Long, and I'll be assisting you today. I know it can feel very stressful to come in for a procedure like this, especially on your face, but we are here to take great care of you. Please let me know at any time if you feel uncomfortable or have any questions. So today, you are scheduled for a Mohs micrographic surgery to remove a basal cell carcinoma located on the middle of your zygomatic bone, which is your cheekbone. Basal cell carcinoma is the most common type of skin cancer. It develops in the epidermis, which is the outer layer of the skin, and it is strongly linked to long-term ultraviolet radiation, which is also known as sun exposure, which can be sun exposure, such as frequent sunburn as a child, and it tends to grow slowly and rarely metastasizes, but it can become locally invasive if not treated. Your procedure will be performed by a dermatologic surgeon who specializes in Mohs surgery. First, a local anesthetic will be administered to numb the area. Once the site has been anesthetized, the surgeon will use a scalpel to exercise the thin layer of tissue. That tissue will be processed in place on slides, then examined under a microscope to check the remaining carcinoma cells. If malignant, the cells are still present. The surgeon will continue to remove another thin layer from the precise area of the cancer where the cancer remains. This is a stage excision, continues until the margins are clear from carcinoma. The procedure will take several hours because each layer must be carefully examined in the laboratory before proceeding. The length of time depends on how deep and how widespread the lesion is. Once all of the cancerous tissue has been removed, the wound will be closed with sutures. Because the surgery is one on the face, there is possible scarring. However, Mohs surgery is designed to preserve as much healthy tissue as possible. Following proper wound care instructions will significantly reduce the risk of infection and minimize scarring. For facial sutures, removal typically occurs within 5 to 7 days. Let's schedule your follow-up appointment for 1 week from today to remove those sutures and assess your healing. Does that time work well for you? And also please remember that we will review detailed post-operative wound care instructions before you leave today. We are here to support you throughout this whole process, and please do let me know if you have any questions.